I wasn't there the night my mother died. That is a sentence that has defined my life for 27 years. And it didn't have to be this way. The night my mother died, I was a college freshman attending a small liberal arts school in Vermont. My mom had been sick for 5 years. In fact, both of my parents got cancer at the same time when I was in the 8th grade. My dad found out first, prostate cancer. And within months of his diagnosis, my mother found out she had stage 4 colon cancer. I'm an only child, and this experience rocked my whole little family. We tried not to talk about it much, though. Tried to pretend like everything was just going to be okay. I used a lot of distractions to keep up that ruse. My love of cute boys and creative writing were my go-to methods. So there I was, chasing the cute boys in my creative writing classes in college when my father called one afternoon. My mom had been in and out of the hospital ever since they had dropped me off in my dorm room a few months earlier. But my dad said they were trying some potentially life-saving last alternative treatments and to just carry on with school for now. But that afternoon when he called me, there was something different in his voice. He sounded tired, resigned. "She's not going to make it," he said, "kiddo. We talked about it, and we think you should just stay at school for now." I remember the air thinning out of the little phone booth where I sat. I remember the sound of kids laughing in the common room nearby. He continued, "You're 18 now, kiddo. The choice is up to you." I hung up the phone, threw a few things in a bag, and set out to drive the 7 hours to where my mother lay dying in a hospital. It was midwinter. I left in the late afternoon. The roads were icy. Scared, stressed, I stopped to see a friend halfway who happened to be a cute boy. And my dad said, "Why don't you stay the night, continue on in the morning?" You can probably guess what's coming next. At 3 a.m., my father called me at the boys' house, and my mother was dead. That moment, there in that boys' house at 3 o'clock in the morning, became a dividing line in my life. It was the moment when there was no going back to who I was before. And who I was becoming was someone who was going to carry a very complicated grief forward with me, a grief that was infused with guilt and pain, anger, and confusion about how my mother had reached the end of her life without any of us quite realizing it was coming. My mother died in 1997. Since then, there have been many studies outlining the disparity between what Americans believe they want at the end of life and the care they actually receive. For instance, we know that 80% of older patients living with incurable cancer wish to avoid hospitalizations and high-intensity treatments at the end of life. We know that missed opportunities at the end of life are far more common, and opportunities for end-of-life discussions are rarely realized. From a 2022 Journal of the American Medical Association study, more than 41% of patients living with incurable cancer believe they had more than 5 years to live, but only 10% of their oncologists agree with those estimates. And nearly 60% of patients with terminal cancer believe their cancer could go away and never return. Based on a Stanford survey of doctors in 2014, we know that physicians are overwhelmingly likely to choose non-aggressive care at the end of their lives. And up to 1/3 of oncologists wouldn't accept the chemotherapy they themselves prescribe. Based on the same Stanford survey, we know that 80% of physicians are likely to choose do not resuscitate orders for themselves. These are all things we know, things most of you in this room know. They've been talked about frequently in the last decade, thankfully. But here's what hasn't been talked about. This disparity between what people want at the end of life and what they receive is resulting in prolonged and complicated grief for the families who are mourning these patients, families like mine. After my mom died, I dropped out of school for a while. I even gave up writing for a time. And although I eventually went back to college, I returned with a crippling anxiety and a complicated grief. At the time, we didn't have as many of the amazing grief resources we do today. Thank you, everybody. And whenever I talked about my struggles with my mother's death, people just told me I would be fine. I was an adult now, just carry on. But by the time I graduated college, my father's cancer had returned. And so while my friends were going off, trying on new apartments and new cities and careers and relationships, I was driving my dad to radiation treatments, caring for him at home, and grappling with the realization that I might lose my only remaining parent. My father's treatment was brutal. The radiation to his hips left him unable to walk. The radiation to his mouth, where the cancer had spread, left him unable to eat. But still, the doctors tried to usher us along to various alternative treatments. I encouraged my dad to listen to them. I so badly wanted him to prolong his life. But after a while, my father said no more treatments. He wanted to go home. He wanted to live out the rest of his life with as much dignity and presence as possible. And he wanted me to help him do so. I cared for him at home with the help of a hospice team in the last few weeks of his life. We were able to have the conversations that we really needed to have. We were able to say goodbye. My father died at 7 p.m. on a Tuesday evening in August in his bedroom, 6 years after my mother. I was holding his hand. It was the last great gift he ever gave me. Because of these experiences, I became a grief therapist. Not what I thought I would be when I was growing up. I'm still a writer too. My 5th book is coming out in a few months. My parents would be proud. And I'm married with a family of my own now. But I became a grief therapist because after my father died, I went on to work in hospice. And what I saw there were so many of these missed opportunities around end-of-life care and conversations. It's well known that hospice is available to individuals with less than 6 months to live. But research shows that the median length of stay on hospice is only 18 days. Many of the debilitating symptoms of pain, nausea, and depression decrease substantially once hospice begins, leading us to wonder how many patients are suffering needlessly for potentially months at the end of their lives. But again, what the studies aren't showing is the impact this needless suffering and lack of awareness around end of life is having on the families who are mourning these patients. Day in and day out, as a grief therapist, I listen to stories of distressing encounters within the medical system. My clients tell me how no one informed them that their loved one was so close to death. They ruminate on the choices they were encouraged to make around treatments that potentially would save their person but didn't. I bear witness to the immense guilt they grapple with due to lack of information. They tell me over and over how they would have done things differently if they had known how little time their person had. They sit in anguish over the missed opportunities to help their loved ones close out their lives with agency and dignity, the missed opportunities to say goodbye. Last year, prolonged grief disorder was added to the Diagnostic and Statistical Manual of Mental Disorders. Some of the symptoms include identity disruption, a marked disbelief that their person is gone, a feeling that life is meaningless, acute emotions characterized by anger, guilt, denial, and blame. Every single client I meet with who experienced these missed opportunities around end of life, every single client who didn't get to say goodbye, who didn't understand how close their person was to death, how their person didn't understand how close they were to death, every single one of these clients meets the symptom criteria for prolonged grief disorder. In fact, on a known risk factor of prolonged grief disorder is the experience of losing a loved one in a hospital. People experiencing prolonged grief disorder describe feeling stuck in time or frozen in their grief. They feel alone, isolated. Their relationships with loved ones suffer, as does their own health. When we lose a loved one, the way I lost my mother, the way so many people are losing the people they love. We are being robbed of the kind of grief we deserve. I believe the ability to grieve is inherent to all of us. I believe that grief can be beautiful. It can be a way to honor the people we love. It can be a way to examine what really matters to us. It can enable us to live more meaningful lives. But that kind of grief, it's not available to those of us who must first sort through the anguish and the guilt and the blame that comes with losing a loved one under the circumstances of missed opportunities. Where have we gone wrong? Oh, where? Let me count the ways. The chasm between what we believe about end-of-life care and what our families are facing in reality is immense. We're at a crossroads. Our collective consciousness needs a transformative shift. The issue isn't just with medical providers, but within the very foundation of the healthcare system. There's an implicit bias that favors action over conversation, procedures over emotional understanding. It isn't just medical professionals, but how society perceives the role of healthcare. Yet isn't it ironic that doctors, the very ones trained with sustaining life, so often grapple with facing its inevitable end? Death isn't a failure, nor is it the opposite of life, but a part of it. It's time all medical schools not only focus on teaching pharmacology and procedures, but place an equal emphasis on communication, empathy, and open, honest conversations about end of life. To all of you, whether you're in the healthcare profession or not, it's time to demand better. It's time for society to advocate for a system that respects our wishes at the end of life, one that provides the comfort and care and dignity we all deserve. Each of us has the power to be an agent of change within our families, our communities, and beyond. So as I stand here, my heart laid bare, here's my plea. Let us confront our discomfort with mortality. Let us prioritize open, honest, end-of-life conversations. For every story I've heard, every tear that's been shed, I have felt a burning need to champion this cause. Because each story reaffirms a truth I can no longer deny. Our current system's inadequacies are leaving far too many grieving souls in their wake. You, me, all of us, we deserve better, and we owe it to future generations to ensure that better is what we get. Because I can't sit by any longer. I can't listen to story after story of a death that didn't have to happen the way it did, without making a promise each time to try to make a difference. Here are 5 ways you can make a difference starting today. Embrace self-awareness. Delve into literature, courses, seminars on death and dying. Understand your personal beliefs around mortality. This is the first step toward meaningful conversations. Foster open conversations, whether it's over a dinner party or community gathering. Initiate dialogue around end of life. Advocate for better medical training. Lobby for curricula that focuses as much on procedures as it does emotional understanding. Our doctors should be equipped to handle every facet of life, including its end. Personal preparedness. Draft a will or an advanced healthcare directive and share it with those you love. Set an example for others to follow. Community engagement. Host a meeting, start a workshop, volunteer in hospice. Engage with the community around these issues. At the end of his life, my father turned to me a few days before he died, and he said, "Kiddo, if there were no death, we'd never know how sweet life really is." It's the last thing he said to me. And it's true. Death is not the problem. The missed opportunities to face it are. Thank you.